Okay, so this last mini grouping includes primarily ophthalmic medications and then some others that kind of didn't really fit into other places, or I wasn't really liking where they were potentially going to fit. So first, the ophthalmic agent. So talking about eye drops and ear drops, and let's see if I can get this to work.
This video will show you how to use eye drops and ointments properly.
Oops. That didn't work. Try it again.
This video will show you how to use eye drops and ointments properly. We'll show you the drops first and the ointment second. The first thing a person needs to know about any medicine is whether it's still okay to use. Check the expiration date on the packaging to make sure. Before using eye medicines, wash your hands with warm water and soap. If you wear contact lenses, take them out before using any eye medicine, unless your doctor tells you that you don't have to. Now, wet a clean washcloth and gently wipe the area around your eyes to clean it before putting the medicine in. Some eye drops need to be shaken, others don't. Read the directions or ask your doctor or pharmacist about your particular medicine. Now, uncap the bottle. Don't touch the tip of the bottle with your fingers. Tilt your head back and pull down your lower eyelid. This creates a pocket to put the drops in. Squeeze the bottle until one drop falls into your lower eyelid. The tip of the bottle should never touch your eye. Apply gentle pressure at your tear duct to help distribute the medicine. If you can't tilt your head back, you can use these same steps while lying on your back and looking at the ceiling. Sometimes people need drops and then ointments, and sometimes they need more than one kind of drop. Either way, the rule is to wait 5 minutes between different kinds of medicines. If you have drops and ointment, put the drops in before the ointment. Now we'll show you how to put ointment in your eye. The first steps are the same as the steps for the drops. Check the expiration date. Wash your hands with warm water and soap and wash the area around your eyes. Uncap the ointment, being careful not to touch the tip of the tube. This time, tilt your head forward. You still gently pull down on your lower eyelid to create a pocket for the medicine. Squeeze a thin ribbon of ointment into the pocket you've made. Then, release the eyelid, lift your head, and blink several times to help spread the medicine across your eye. You should expect your vision to be blurry for a moment. Keep blinking and don't rub your eyes. You can also close your eyes for 30 seconds or so, and the blurring should go away. All you have to do now is replace the cap, then wash your hands one more time to remove any extra medicine. Most eye drops and ointments should be stored at room temperature, out of direct sunlight. Some need to be refrigerated. Your doctor or pharmacist will tell you if yours needs refrigeration. It's important to keep the bottles or tubes clean to prevent infection. Using eye drops or ointments doesn't have to be difficult, as long as you follow these simple steps.
So one of the things, did you notice where to put the medicine away? in a closet across from the bathroom, not in the bathroom. People keep their medicine in their bathroom. It's humid. It's heat. Your shower. Not a good environment to keep your medicine. It should be kept in a safe, like a closet, in a linen closet out of the bathroom, in a lockbox in the bedroom, something like that. So just another piece in there. So proper use of eye drops is important. Oops, I don't want that. I want the next screen. So the first set of drugs that we're going to talk about are drugs that are used for glaucoma. So glaucoma, hypertension in the eye, or intraocular pressure, which is a symptom of a glaucoma. So here's just a quick little video on glaucoma.
Glaucoma is a leading cause of blindness for people over 60 years old. Unfortunately, only about half of the people who have glaucoma even know they have it. This is because it has no early symptoms. Eye doctors sometimes call it the sneak thief of vision. Glaucoma is a disease that damages the optic nerve. This nerve is responsible for sending visual messages from your eye to your brain. Glaucoma typically happens when the fluid in your eye does not drain as it should. Fluid gradually builds up and increases pressure in your eye. That pressure is what damages the optic nerve. Blindness from glaucoma can often be prevented with early treatment. Treating glaucoma won't bring back any vision you have lost, but it can help save the sight you still have. In the healthy eye, fluid called aqueous humor is made in the front of the eye and flows out through a tiny drain called the trabecular meshwork. The trabecular meshwork is located in an area called the drainage angle. If fluid doesn't flow out of the drainage angle properly, eye pressure increases and damages the optic nerve. There are several types of glaucoma, but the most common form is called primary open-angle glaucoma. This type occurs when the trabecular meshwork of the eye gradually becomes less effective at draining fluid. As this happens, your eye pressure rises, leading to damage of the optic nerve. As more optic nerve damage occurs, blank spots begin to appear in your field of vision. You probably won't notice these blank spots in day-to-day life until the optic nerve is significantly damaged and the spots become large. If the optic nerve is severely damaged, that eye will go blind. Eye pressure rises and falls from day to day and hour to hour. Therefore, a single eye pressure test may not detect glaucoma in some people who actually have the disease. This is why it is very important to see your ophthalmologist regularly. He or she will monitor your eye pressure, examine your optic nerve, and check for any vision loss that may have occurred. There is no single normal eye pressure number that applies to everyone. Optic nerve damage can happen at different eye pressures in different people. If your ophthalmologist determines that you have glaucoma or feels you are at risk for developing the disease, he or she will establish a target eye pressure specifically for you. That target pressure is to protect your optic nerve from damage. There are several ways to treat glaucoma depending on the type you have and how far it has progressed. The most common way is with eye drop medication. These medications lower your eye pressure in one of two ways. They either reduce the amount of fluid produced by the eye, or they help this fluid flow out of the eye through the drainage angle. Glaucoma eye drops must be taken every day as prescribed by your ophthalmologist. Surgery may be recommended for some people with glaucoma. Glaucoma surgery improves the flow of fluid out of the eye, helping to lower eye pressure. Treating your glaucoma is important for preserving your vision and your quality of life. If you have any questions or concerns about your eyes or your vision in general, don't hesitate to bring them up. Your ophthalmologist.
So the thing about glaucoma, and one of the things, we dispense a lot of glaucoma meds. It's a complication of diabetes as well. So somebody can have glaucoma and not have diabetes, but a lot of patients who have diabetes also have glaucoma. So there is that relationship, and that's part of the reason that they go blind. So as she was saying in the video, basically there's two goals in the mechanism of the agents that we use to treat glaucoma. It's either to decrease the fluid, so less is there so it's not pushing, or increase the outflow of the fluid. Beta blockers, which we use for hypertension, it's ocular hypertension, glaucoma. So in that sense, it kind of makes sense. They work in the eye as a topical application, an ophthalmic application, to decrease the fluid production. Carbonic anhydrase inhibitors, which is actually a class of diuretic, also works to decrease the fluid production. Drugs we use to increase the output of the fluid include prostaglandins, which we often see abbreviated as PG for prostaglandin. And then alpha agonists will do both. So as they said, you may be using or patients may be using a combination of these agents to get the result that the doctor is looking for. So the first drug is a beta blocker. So this is going to decrease the fluid production. Timolol ends in OLOL, but the ophthalmic version is Timoptic. It comes in 0.25 and 0.5%. Comes 5 and 10 milliliter bottles, and its dosing is 1 drop twice a day. We want to make sure when we dispense these, they have the for the eye warning label, auxiliary label. These are sterile. These are also what we call isotonic, which means that it's not going to change the pressure. It's not going to increase or decrease the pressure in the eye. It's going to be the same as your blood. Durolzamide is Trusopt. Anything that ends in olamide is a carbonic anhydrase inhibitor. And it comes only in one strength, 2%, and it comes as a 10 milliliter vial. And you see that they've changed the look of the bottle. It used to be that almost all of your eye drops looked almost the same. So it created a lot of confusion, especially since there's a lot of sound-alike lookalikes. But some of the manufacturers have changed their packaging. So this is a traditional eye drop vial where this has a special kind of bottle. This dosing is 1 drop 3 times a day. Trusopt, 3 times a day. Durolzamide, Trusopt, with Timolol, we're combining them, is Cosopt. And it comes with a combination of 2% of the Durolzamide with 0.5 of the Timolol. And it's also dosed twice a day, like the Timolol. Now, your prostaglandin agents, these are the ones that are going to increase the outflow. They have prost in the drug name for prostaglandin. So prost is your drug stem. Bimatoprost is Lumigen, which comes 0.01%. Comes in 3 different sizes. It's dosed at bedtime, 1 drop. It also comes by a brand name of Latisse. So we found patients who used this Lumigan, I should say, not Gen, but Gan, for glaucoma. They were noticing that their eyelashes were looking a little thicker. So they now market it in a different strength for increasing the thickness in your eyelashes. It comes with these little brush applicators. So you put a drop on the brush and you put it on the top, right on the edge of your eyelid where your lashes are, and it helps to thicken up the lashes. Latanoprost is Xalatin. Now this one comes only in 1 strength, 0.005. It only comes 1 size, and it's dosed 1 drop at bedtime. So your prostaglandins are used at bedtime. This drug is kept refrigerated through the cold chain until it's dispensed. Once the patient opens it, it's okay for 6 weeks at room temperature. So the patient needs to know that. Now, this drug has an odd component. If somebody has light eyes, green eyes, blue eyes, it can turn them like a hazel, brownish color. It and it can be permanent. It can change the color of the iris. That's with a long-term use. It's not one of those new freaky ones that they have out there that change your eye colors. Or you wear color contacts. There's lots of ways to change eye color. Travoprost, again, prost for prostaglandin, is Travatin Z, and it comes 0.04%. Comes 2.5 or 5 milliliters, and again, it's prostaglandin, 1 drop at night. Now, your alpha agonist is going to have that 2 pieces. It's going to help decrease the production of fluid, and it's going to help increase the outflow of fluid. Brimonidine, which is alpha-Gin P, and it comes 2 strengths, 0.1% and 0.15%, and it's dosed twice a day. So those are your glaucoma agents. Now, probably all of us at some point in time have had irritated eyes, right? Red, itchy, could be from allergies, could be from stress, you're overtired, maybe you got something in your eye and you rubbed it so much that it's now all red and inflamed. We call that red eye or allergy eye. It's an allergic conjunctivitis, so allergies can cause it, and it causes inflammation. We can use steroids, reduce the inflammation. These are ophthalmic. These are considered topical. Loprendanol, which is an ophthalmic suspension. They need to shake this vigorously because it's kind of thick. They want to make sure it's really mixed up well. Alarex is one brand name. That has a strength of 0.2%. And Lotamax is a different strength, and that is 0.5%. So there's a difference between the brand names. They're made by the same manufacturer, but that's how they differentiate the different strengths, is by changing the brand name. For the Alarex, right, allergy eye, 1 drop 4 times a day. And for the Lotamax, 1 to 2 drops 4 times a day. Olopatadine is known as Pataday, which has a strength of 0.2%, which the patient would use once a day, or Patanol, which is only 0.1%, it's half of it, it's used twice a day. Those administrations should be at least 6 hours apart, 6 to 8 hours apart. So if they do it in the morning, in the afternoon, they can use the second dose. And then we have a combination of a decongestant with antihistamine. So how many of you have ever had bloodshot eyes? Just about everybody, right? What causes it? Crying? Well, what makes them red? It's the blood vessels. The blood vessels get swollen. So we have, like, when your eyes are nice and white and clear, they're still there, but they're so small you don't see them, so your eye looks white. But when those blood vessels get enlarged, they're more visible. So how do we shrink blood vessels? Well, we can use a decongestant. Decongestants are vasoconstrictors. So this is a topical decongestant. We put it in our eye, it shrinks those blood vessels down. Plus, now you don't have the inflammation causing the itchiness. Phenyramine is an antihistamine. So these are great for allergies. And they usually have the A on the end for allergy, Nafcon A, Visine A. That tells you it's got an antihistamine in it. So they're the same strengths, different brands, different sizes. Dosing is the same. You can use 1 to 2 drops in each eye up to 4 times a day. Now, you can also just use a decongestant alone to reduce the redness in the eye. Oxymetazoline, Visine LR, or Ocuclear. The other thing, I might have talked about it in respiratory, it comes as a nasal spray, a decongestant nasal spray called Afrin. So again, it's doing that vasoconstrictant to open up your airways. Now, Afrin shouldn't be used more than twice a day, because people can become dependent on a nasal decongestant. And if they use it too much, they always feel stuffy. It causes a rebound stuffiness. Now, if somebody has an infection, That's referred to as pink eye. So allergy eye is red eye, but pink eye is an infection. And it can be caused by a virus. It could be caused by a fungus. But the only one on the top 300 list was for bacterial. This is a quinolone, gatafloxacin, Zymaxid. It comes 0.5%, which means there's 0.5 grams per 100 milliliters. This comes in a 2.5 milliliter bottle, and it's dosed 1 drop every 2 hours while awake, up to 8 times on the first day. Anybody ever have pink eye? Or kids get it a lot. It's like other things. Kids like to share it. Oh, rub my eye, I touch you, you rub your eye, we share. It's highly contagious. So if anybody has pink eye, they're told stay home. Make sure you wash everything, sanitize, phones, anything that somebody else could come into contact with. We don't want that shared. So the faster it's treated, because usually after the second or third day, you're okay to go back to work or school. So that first day, you're using it a lot. That's loading dose. We're getting it all in there. Then afterwards, you're going to use 1 drop 2 to 4 times a day for a week. It'll depend on what the doctor says. So those are the ophthalmic drugs. There's a topical corticosteroid that I'm going to talk about. This drug is used to treat eczema, psoriasis, contact dermatitis. Clobetasol. So this doesn't end in sonolone, nisolone, all of those usual sound-alikes for your, or drug stems for your corticosteroids. The dose, you apply a thin layer to the affected area. Steroids, thin layer. We don't want it slathered on because it absorbs. And if we get too much, it could actually affect the way the adrenal glands produce our own natural corticosteroids. So twice a day it's put on in a thin layer, rub in gently and completely. Don't use for more than 2 weeks, and don't cover it up. Don't occlude it. Don't put a bandage on it. Don't cover it up. There's a lot more brand names, but 2 of the more common ones. Temavate, which comes in a cream or an ointment, and it's the same strength. They're all 0.05%. Cream comes in a 30-gram or a 60-gram tube. Ointment comes in a 15 or a 30-gram tube. Cream is going to absorb a little bit better than an ointment, because an ointment is oil-based where a cream is water-based. It also comes as a gel. Now, Clobivate is a brand name, but it's no longer being made, so I picked 2 of the most common generic manufacturers for creams, ointments, and things like that. This is the gel formulation, and that comes in a 45-gram tube. Gels also absorb pretty well because gels are water-based. And again, this one has a warning label too. We want to have that for topical use or external use only on that label. And then we've got a couple of vitamins and minerals. Bless you. Please know the difference between a vitamin and a mineral. As I was grading the TPs for the students who are about to finish up, they would like put vitamin on potassium. No, that's a mineral. So saline is a mineral. It comes from sodium, salt, sodium chloride, NaCl, salt, saline. Saline is a salt solution. So we use saline in different varieties of products. We have IV solutions. We have quarter normal saline, half normal saline, and then we have things like 3% saline, which is hypertonic solution. And that has to do, again, if somebody's not got enough sodium in their body, we might want a hypertonic solution. Get more sodium in so the cells will absorb the water and the sodium. Maintain hydration, treat hyponatremia. Now, we use it topically, ocean spray. So this is one of those stories, and I may have talked about it in respiratory. My teacher was telling us the doctor told the guy, go get some ocean spray because he had a stuffy nose. And he said, it's not really working, it's just sticky. because most people think cranberry juice when they hear ocean spray. But ocean spray literally is saline, like the ocean. It's salt water. So that's where that comes from. So you got to kind of make sure it's a saline spray. But again, when I was talking about the Afrin, instead of overusing the Afrin in between your doses, when your nasal passages are dry, they feel stuffy. So by using the saline spray, it can help you feel less congested, just because you're moisturizing. Mura 128 is an ophthalmic solution. And this is actually a hypertonic. It pulls water from the cornea if the cornea is swollen. So that would be an indication for that. Sodium fluoride, and this is more about the fluoride part than it is about the sodium, but it's the chemical component. This is called Fluoriday, and it comes chewable, it comes in drops, and we use this to help prevent cavities. So people who live in areas where they don't have fluorinated water, maybe they live in a rural area that doesn't get processed water, they get it from a well, they're not getting fluorine like people who live in cities that their water is fluorinated. They get that fluoride in the water. The next one, now those are minerals. Fluoride is a mineral, sodium is a mineral. Now we've got vitamins. So cyanocobalamin, which is probably one of my favorite words. I just think it's a cool word. That's vitamin B12. Vitamin B12 has brand names like Cobalin M or Depo-Cobalin. It's given injection. This drug is used for pernicious anemia. So pernicious anemia is a specific type vitamin B12 deficient anemia. Sure. So minerals are earthly substances. Like, when I think of it, I kind of think it could be a rock, in a sense. So a mineral is an element. Like elements, magnesium, calcium, things that are actually elements. Vitamins are chemicals that we get from our food and make in our body. It's not just one substance. Well, no, we don't have it all. We have to get it from other sources. We have to get the vitamin piece from food sources or from sunlight. So there's different ways that we get our vitamins. Same with minerals. Like we can get salt from our foods. It'll be in some foods naturally. But we can extrapolate the salt out and it's just salt. These are actually chemical compounds. Vitamins are actual compounds. It's not just one piece entity that you can extrapolate to mean its own entity. A mineral, you can get sodium. You can get potassium. You can get magnesium, selenium. There's a whole bunch of different ones that we need in our body. Zinc. Those are all minerals. Vitamins, they say vitamin. We've got A, E, D, K. Those are your fat solubles. Your water solubles are your B and your C. So we get them from food sources. So cyanocobalamin, a few things about it. It's yellow. So when we are making an IV with it, we have to protect from light. If we add it to an IV, the IV is only stable for 24 hours. There's a few things when we use cyanocobalamin. But if we don't have enough of it, we're going to have problems with our red blood cells, which can cause a specific type of anemia. Ergocalciferol is vitamin D2. So we know Bs, you got B1, B2, B3, B5, B6, B9, B12. There's lots of Bs, B complex, whatever. These have multiples too. D2 and D3 are the more common ones. Ergocalciferol is vitamin D2. It helps treat rickets, which means that your bones are soft, or hypoparathyroidism. That's the chemical that balances our calcium levels in our blood, calcitonin from your thyroid and parathyroid from your parathyroid. So if you don't have enough parathyroid, you can have weak bones. Calciferol is one of the brand names. It comes as a soft gel cap, and calcidol comes as drops. Calciferol with alpha tocopherol. So cholecalciferol is vitamin D3, and alpha tocopherol is vitamin E. And this is also for rickets and osteomalacia. And osteomalacia is also a softening of the bone component. Now, vitamin D we can get from the sunlight, but not everybody lives in a place where they have lots of sunlight. People in Seattle, it's cloudy most of the time. People in Alaska, that, you know, most of their daylight is like not there, except for in the summer for a couple of weeks. For us, 5 to 10 minutes a day in the sunlight, we usually get enough vitamin D. If somebody's home, bedridden, incapacitated, they can't get into the sun. We can also get some of our vitamin D supplements from things like our dairy. Milk is fortified with vitamin D because it helps with the absorption of calcium. So that wraps it up. That's it. A bleep. That's all, folks. So, next,